When you're looking for help with a medical problem, naturally you need a remedy that matches your problem. Answer therapy is a new form of medicine, so you need to be clear about the applications before you make an appointment. When I say applications, I'm referring to reports from clients of chronic pain elimination, or pain that was permanently reduced, almost completely gone, or prolonged pain relief that was extraordinary. The pain eventually came back, like with advanced osteoarthritis, or periodic pain that was managed by clients independently, like with certain cases of low back pain. In almost all cases, clients report pain elimination. The goal of answer therapy is independence from all pain medicine, including answer therapy. There are many different sources of chronic pain. Everything caused by the source is a symptom. For example, spinal subluxation can cause pain, but it's actually a symptom of a deeper problem. If you want pain elimination for any problem, you need to either heal the source of pain or somehow neutralize it so it becomes a non-issue. In almost every case I've seen, the autonomic nervous system healed the symptoms and the source of symptoms. I don't offer pain management. I'm interested in pain elimination, so I don't work with conditions that don't respond quickly or dramatically. Dramatic improvement has been reported by my clients in 2 visits on average. That means many people need only 1 visit. Most people need 2. And really severe cases need 3 or 4 visits, but rarely more than that. Now there's a detail I need to point out. Technically, aside from pain and muscle tension, I don't treat symptoms or diseases. Answer therapy provides a profound level of comfort, but that's all. Your nervous system decides what to do with that increase in healing potential. Answer therapy applications are all types of pain or discomfort, or even chronic stress due to disease. As a scientist, it's my duty to report my observations to the world. But as a licensed alternative practitioner navigating a dysfunctional healthcare system, I'm obligated to state my offerings as being within my legal scope of practice. The most common application of answer therapy is chronic pain caused by injuries. But what kind of injury? Mainly traumatic injuries, which means there was an impact or yanking force that was strong enough to cause damage. It doesn't matter what part of your body was injured, how long ago you were injured, how many times you were injured, how severe your injuries were, what conditions were caused by your injuries, or how many other remedies you already tried. If you had a traumatic injury, you're probably a candidate for answer therapy. That means you can expect dramatic improvement. I've also seen some overuse injuries, which happen gradually. For example, in my list of case studies, there's a client who had post-polio. She had chronic low back pain because her legs were different lengths. I consider that a type of overuse injury due to the strain she was putting on her low back for decades. She responded perfectly to my low back protocol. What I don't work with is sports overuse injuries, which usually involve internal scar tissue that inhibits free movement. When you have scar tissue problems, it means the pain is caused by a structural problem in the musculoskeletal system, as opposed to trauma held in the autonomic nervous system. For actual structural problems, you need a manipulation method to correct that problem, as opposed to relaxation that allows your nervous system to remove the trauma. Pain relief methods are not interchangeable. They need to match the problem. So for sports overuse injuries that involve scar tissue, you're better off looking for sports massage or a treatment called FSM, frequency-specific microcurrent, can dissolve internal scar tissue and accelerate tissue healing. I share a video about FSM on my website. Every pain research center in the world needs to watch that video, but they ignore FSM just like they ignore answer therapy. However, if your sports injury is a traumatic injury, you're probably a candidate for answer therapy, because you probably have trauma held in your nervous system, and your nervous system knows exactly how to remove it. That's how answer therapy works. For example, removing trauma from the head is one of my specialties, and many head injuries occur in sports. Tendinitis is another overuse injury that's not a match for answer therapy, simply because there's a different remedy that's better. Old-fashioned ice therapy can do wonders for tendinitis, but you could also try FSM if you can find it. Another basic application is chronic neck or back pain, regardless of the cause. If you're doing pain management for chronic neck or low back pain, I guarantee you're missing out. There are some rare exceptions that might be better off with pain management, such as severe scoliosis or spinal implants, but feel free to send an application anyway. I've seen clients who had several low back surgeries but still had chronic low back pain. They did very well with answer therapy. One of them is in my list of case studies. Also, if you had a recent neck injury, I recommend getting answer therapy as soon as possible. It can help remove the trauma from your nervous system and prevent neck exhaustion, which I talk about later. I've had mixed results with metal plates used to reconstruct bones. In some cases, the plate inhibits nervous system healing responses. On the other hand, in one of my interviews, the client's collarbone was broken in several pieces, and she needed a metal plate to hold them all together. She did extremely well with answer therapy. I've also had mixed results with migraine headaches. Success depends on the client's body type. Most people respond perfectly, but some people get only partial pain relief. Most people I've seen stopped getting migraines altogether after an average of 4 visits. Again, look at my list of case studies. Regardless, you would need to come to my office with a migraine in progress or with pre-migraine symptoms, which can be tricky to schedule. Migraines and fibromyalgia are both central nervous system problems, but I don't work with fibromyalgia. Again, I don't offer pain management. Fibromyalgia can be cured by FSM, so why mess around with pain management when your pain is curable? I've had surprising results with osteoarthritis pain. That's one of my big discoveries. There's a nervous system healing response that cleans out a type of toxin that's not acknowledged by mainstream medicine. I believe that toxin causes osteoarthritis. My clients have reported instant traumatic pain relief that's either permanent or strangely prolonged, even with a diagnosis of advanced osteoarthritis. I don't work with neuropathies in general, with one exception. In the late 90s, when CRPS was called RSD, I had a client with third-stage RSD after 14 years of chronic pain. Her right foot had atrophied down to 75% of its original size. But her nervous system cleaned out the same toxin, which allowed her foot to regenerate its original size. It filled her shoe again, and her pain stopped almost completely. She's in my list of case studies. I've been telling people about that case for decades, but no one wants to know about it. So I'm willing to work with CRPS pain experimentally. It's all research to me. And by the way, FSM can cure most or all neuropathies, including any stage of CRPS, if you can find a practitioner who knows how to use that technology. This part is very important. If you have a systemic infection, like the common cold or flu, You need to heal the illness before you do answer therapy. When you have a systemic infection, you also have a systemic stress response that you need for recovery. If you relax that stress response, the illness might get worse. You can do lightweight relaxation methods that help your immune system, like petting animals or watching funny movies, but avoid deep relaxation. If you're not sure whether or not you're a candidate for answer therapy, feel free to send me an email or my online application with as much detail as possible, so I can recommend answer therapy or something else. To really understand answer therapy applications, you need to know how the autonomic nervous system responds to absolute comfort. Like I talk about in my other videos, when you reach a critical level of comfort, you cross a threshold into nervous system self-regulation. At that point, your nervous system can access healing responses that it cannot access at your regular daily stress level. Your body chooses which healing response to use. That means there's an actual healing process happening, as opposed to fighting with symptoms with manipulation. All the benefits of answer therapy result from actual healing, because there's no manipulation. There are two types of nervous system healing responses: primary responses that permit secondary responses. I also describe them on my website if you'd like to see a list. The first primary response is spontaneous balancing of muscle tension. Spontaneous means there's no manipulation. It's an internal process. It's not always reduction in muscle tension, because sometimes you need more tension for secondary responses, like stopping a migraine. The most important secondary response permitted by muscle tension balancing is deep relaxation of muscle spasms. A spasm is an involuntary severe muscle contraction. It's often painful and can be chronic for many years. For example, some people had injuries to their neck or shoulder that made their neck, shoulder, and upper back rock hard, like a piece of leather wrapped around a rock. What do you do with that tension? You cannot get that extreme tension back to normal by using manipulation. At best, you can get momentary pain relief with massage or acupuncture. But when you access nervous system self-regulation, even that tension will relax automatically, and the pain will stop. Most chronic pain clients don't have tension that severe. I'm using that example to let you know what your nervous system can handle. Your nervous system produces that tension, so it can also relax that tension, stop your pain, and bring back your normal range of motion. That response has been so consistent that I need to say it's totally predictable. Another secondary response that's documented on my website is spontaneous realignment of the skeleton, again without manipulation. As your muscle tension balances, it gets tighter here, tighter here, tighter here. That shifting of tension pulls your bones around. Your body knows where your bones belong, and it will put them there when you're not blocked by chronic tension. You can feel your bones moving during an answer treatment. Another secondary response happens with migraines. It's actually a bioenergetic event with a complicated explanation. But basically, the muscle tension gets tighter in the large muscle groups, but without causing pain. Tension is not the enemy. Pain is the enemy. The extra tension pulls that chaotic activity down out of the head, so the head can relax, which stops the pain. If that process is repeated a few times, it seems to reprogram the nervous system. To summarize, muscle tension balancing gives you less tension where you don't want it, more tension where you need it, and sometimes momentary tension that repositions your bones. During answer therapy, your nervous system chooses the ideal amount of tension, sometimes less, sometimes more. But in every case, the muscles are deeply relaxed, so there's no pain. When an increase in tension happens, it's actually the result of relaxation. Most manipulation methods try to force or trick muscles to let go of tension. But less tension does not equal relaxation. This is a big misunderstanding in the massage therapy profession. Only your nervous system can relax your muscles. You cannot force your nervous system to relax. If your pain comes right back after manipulation, it means your relaxation response was minimal. I had a migraine client who got migraines when she went to a physical therapist. He tried so hard to force tension reduction that he bruised her back with his fists, both sides of her spine. Remember, when it comes to the autonomic nervous system, medicine is still in the dark ages. You need either really good manipulation that invites real relaxation, or you need an internal healing process that relaxes everything at once. Also, since the 90s, clients have told me they stopped getting chiropractic after receiving answer therapy. Why is that? When your bones reposition involuntarily, that healing process also cleans out the trauma that was causing the problem. It's more than simply putting your bones back into place. That's what chiropractic does. Your nervous system can do better than that. It can heal the source of the problem very quickly when it gets the right support. That brings me to the next primary healing response. The next primary healing response is something I discovered in 1997. I call it the pain discharge mechanism. It's so important that I need to take a few minutes to explain it thoroughly. Like I said, chronic tension is an involuntary contraction of tissues. If you have a spot of chronic tension, it means you have some pathology in that area that's not healing, like a chronic muscle spasm. Your healing process in that area is blocked. The pain discharge mechanism is also an involuntary contraction of body tissues, but it's actually a healing response. It's a sudden, involuntary, hard contraction of all the tissues in a spot of pathology. It cleans out the pathology in that spot. It removes the root of the problem. And it can occur in any cubic inch of the body, literally from head to foot. I call it pain discharge because it hurts. It's a few seconds of a sharper pain that eliminates chronic pain. That's been a consistent observation since 1997. I call it a discharge because it's basically the same nervous system mechanism that discharges painful emotions. Emotional discharge has been studied for more than a century. But pain discharge is a discharge of physical pain related to physical pathology. It's new medical science. Chronic pain caused by traumatic injuries is an epidemic. Injury-related pain can be anywhere in the body, any spot that was injured. Why is injury-related chronic pain so common? Because after the injury heals, there's still a memory of physical trauma in the old injury site. I call it injury memory. It's a chronic pathology. It was also called shock by a famous osteopath, Dr. Robert Fulford, who removed shock with a unique type of manipulation. Your nervous system is shocked by a traumatic injury. The injury heals, but the shock never relaxes, just like psychological trauma. If that chronic contraction is strong enough, it can cause pain in the injury site and the surrounding areas for decades. It's a huge moneymaker for the pain management industry. However, pain discharge erases injury memory for pain elimination. That's a secondary healing response, erasing of injury memory after the injury heals. That's how your nervous system is supposed to heal injury-related chronic pain. It's a natural mechanism. But no one else knows about it because they don't have a method that activates the pain discharge mechanism. For example, there's a head injury case in my list of case studies. 32 years after this client healed a severe concussion, the injury site had no pain because the injury healed many years ago. But he still had chronic neck trouble and frequent headaches. During his one treatment, he felt a dull ache at the injury site, which reminded him of his old injury. He had forgotten the injury, and he never saw the connection between his concussion and his neck pain. That dull ache became a sharper pain which abruptly stopped. That was a pain discharge. His neck tension relaxed instantly without any attention to his neck. I shared an office with this guy for 8 years, so I know he had pain elimination after that one treatment. That's the typical result of a pain discharge. I estimate that the vast majority of chronic pain cases caused by traumatic injuries would be healed by the pain discharge mechanism. I also think it could be triggered electronically if someone could invent the right device. Since 1997, I've been watching people's reactions when they first hear about the pain discharge mechanism. I know it can be challenging to understand it. So let me spell out the logic. Let's say you fell and injured your knee 20 years ago. You needed surgery for a torn ligament. You've had chronic pain ever since. You wear a knee brace, which helps a bit when you go out hiking. Your doctors give you cortisone shots and recommend physical therapy, which makes the pain worse. Then they say there's nothing more they can do. You'll have to learn to live with the pain. Then you hear about ANSSR therapy, and you say, look, I tore a ligament in my knee 20 years ago. I tried everything for it. My doctors say there's nothing more they can do. No relaxation thing is going to help my knee. Let's examine this. You healed the injury 20 years ago. Why do you have chronic pain? Because all the tissues in your knee are chronically contracted, which means there's chronic tension in your knee. That tension is a function of the autonomic nervous system, not the musculoskeletal system, bone, cartilage, muscle. Severe tension causes pain. That was proven by Dr. John Sarno. When he told his patients to relax, their back pain stopped, even when they had 7 herniated discs, spinal stenosis, etc. Their tissue damage was still there, but their pain stopped because their tension relaxed. In your case, the tissue damage already healed, but the tension is still there, that injury memory. The discharge mechanism is designed specifically to remove trauma from the nervous system, either psychological trauma or that physical shock. You need a relaxation method to get a pain discharge from your knee, but not just any relaxation method. Massage, acupuncture, Reiki, etc. Those methods don't access the pain discharge mechanism. Sometimes people have emotional discharges when using those methods, randomly, but not a pain discharge from the injury site, which happens predictably with ANSSR therapy. Your doctors don't know about the discharge mechanism. Evidently, I'm the only practitioner who knows about pain discharge. I've been telling people about it for decades, doctors and researchers in 12 countries, but no one wants to know about it. Pain management doesn't want pain elimination. Now let's say you've had chronic pain in your hip for many years, in addition to your knee pain. You never injured your hip. What happened? In many cases of injury-related chronic pain, the original injury causes a chain reaction in the surrounding areas, like the head injury case I just mentioned. And in some cases, there's no pain left in the original injury site. There's only secondary pain, which is still injury-related pain. When you get a pain discharge, it happens only in the original injury site, not the secondary pain areas. When you remove the original injury memory, there's nothing to provoke a stress response in the secondary areas, so that pain is also healed. Now let's say you've had injury-related knee pain for 20 years. 10 years ago, you were diagnosed with osteoarthritis. Now your doctors say that's causing your chronic pain. What happened? Many cases of knee or hip osteoarthritis are caused by a traumatic injury. What's the connection between an injury that healed years ago and this inflammatory process we call osteoarthritis? Over time, the chronic tension in that joint causes stagnation of the tissues, like a stagnant pond stuck in your body. I believe the accumulation of toxins causes osteoarthritis. What do you need? You need to relax that chronic tension so the blood vessels can expand again and flush out the toxins. In my experience, pain discharge relaxes a joint with osteoarthritis for immediate pain relief, but also permanent or prolonged pain relief depending on the amount of cartilage that's left in the joint. The absence of pain suggests that the inflammatory process is actually stopped, which might be a good time to get regenerative medicine to rebuild the cartilage. There are different kinds of toxins that accumulate in a spot of pathology. Of course, we have biochemical toxins, but there's another toxin that's not acknowledged by mainstream medicine, even though it's extremely significant, and that is stagnant biological energy. It was discovered in the human body and the atmosphere in the early 1900s by the founder of Western bioenergetic medicine, Dr. Wilhelm Reich. He called it deadly orgone, or DOR, D-O-R, because it's very toxic. It's a factor in many illnesses, including cancer, and it's difficult to get out of your body. But your nervous system can eject it from a spot of pathology using the pain discharge mechanism. Theoretically, biochemical toxins are flushed out of that spot over days and weeks when your circulation is expanded. But DOR is expelled immediately with a pain discharge. When it comes out in a cloud in your face, you'll have no doubt about the existence of biological energy. The famous healer Barbara Brennan called it etheric mucus, and she removed it with various manipulation techniques. But your own nervous system has a built-in mechanism for removing it. That's another secondary healing response: removal of DOR, stagnant biological energy. Now, when you're not familiar with DOR, it's easy to underestimate its impact or the benefits of removing it. For example, I believe it causes osteoarthritis. What if you have knee or hip osteoarthritis, but you never had a traumatic injury? You might have no injury memory that needs to be erased by a pain discharge. But a pain discharge occurs anyway that ejects a cloud of DOR from that joint. There's an osteoarthritis case in my list of case studies. A 70-year-old woman, 80 pounds overweight, with advanced knee osteoarthritis and severe secondary pain in her hip. She had a single 20-minute treatment, followed by exercise in a swim class. No knee pain for almost a year, even with bone-on-bone osteoarthritis. And that severe pain in her hip never came back. There's another case where the client regenerated the original mass of her foot after 14 years of atrophy due to third-stage RSD. Her RSD, now called CRPS, was caused by a traumatic injury. However, she came for answer therapy every 2 weeks for several months and got a discharge each time, which gave her deeper pain relief each time. The injury memory was long gone, but her foot and ankle continued to discharge door until her foot was back to normal size. There's another case with a counseling client who was a worst-case scenario for hepatitis C. After she started chemotherapy, she started getting door discharges from her liver. After multiple discharges, her blood test showed 0 virus. Her doctors were shocked. These are all clients from my list of case studies. None of their results are supposed to be possible. It's actually very simple. Your body detects DOR in a spot of pathology and removes it with the basic function of the autonomic nervous system. Another secondary response to the discharge mechanism is the removal of early life trauma in babies. That's actually emotional discharge, not pain discharge, but it's basically the same mechanism. Naturally, the baby is suffering from stress, so I help them relax with a specific answer protocol. In the process, they convert their trauma to emotion that they discharge by crying. Before and after comparison is dramatic, to say the least. When babies are young, their nervous system can remove trauma in 1 or 2 visits. But as they get older, that trauma is buried in their body. That trauma determines their behavior and personality. So while they're still a baby, you want to make sure they're capable of experiencing profound comfort. If they don't get that trauma out, they will never again relax completely without professional help. That's why discharge of early life trauma is my most important discovery. To summarize, the discharge mechanism is a primary healing response with 3 secondary responses. Removal of injury memory, stagnant biological energy, or repressed emotions. You could also think of them as 3 types of discharge. The immediate and long-term benefits are profound. When you're exhausted from chronic pain or illness, you experience comfort when you get energized. The goal of answer therapy is absolute comfort, which means you get very energized. This is another primary healing response of the autonomic nervous system. Stress is draining, but relaxation raises your energy level. And your body needs to be energized before it can activate certain healing responses. That's why the answer protocol for adults is facilitated relaxation in the first few minutes, followed by facilitated rest for most of the treatment. Your energy level rises through the whole treatment. A predictable secondary response is better sleep. Everyone reports having better sleep after their first visit. When you're stressed from pain or illness, that systemic stress interferes with your sleep. So you need to relax while you're awake. First, you get energized from the answer treatment. Then you're able to sleep better at home, which recharges your batteries even more. When you come for your next answer treatment, if you need one, your body can do even more healing work because now you're energized from better sleep. That's why most people need 2 treatments to access the pain discharge mechanism. They need the first visit mainly for rest. The discharge mechanism is work. It requires energy. For some people, exhaustion is not an issue, but they still have chronic pain caused by injuries. Those are my simple cases that go straight to a pain discharge in 15 or 20 minutes. It's the amount of rest you need that determines the length of your treatment and the number of treatments you need. Another secondary response is specific to the neck. I estimate that at least 80% of chronic neck pain cases are caused by one distinct pathology I discovered in the 90s. I call it neck exhaustion. I have a separate video just for neck exhaustion. Your whole body can be exhausted, but your neck is extra vulnerable. Chronic tension in the neck leads to exhaustion, which causes more tension. Eventually, you can develop any kind of spinal degeneration, osteoarthritis, stenosis, bone spurs, etc., because degeneration is caused by chronic tension plus DOR. The way to eliminate neck exhaustion is to relax your chronic tension to the point where your neck can rest properly for the first time since your neck pain began. Energizing rest eliminates neck exhaustion and therefore chronic pain. It's one of the most important discoveries in the history of pain medicine. The reason no one else knows about neck exhaustion is because no other method accesses spontaneous muscle tension balancing. That means they cannot rest your neck properly. If you don't rest your neck completely, the exhaustion never goes away. If you have injury memory in your neck from an accident, or you have muscle atrophy caused by DOR accumulation, that stuff is cleared out as you rest during an ANSSR treatment. If you're a bodywork practitioner, you might be able to use my protocol if you watch that neck exhaustion video. There are more secondary responses to energizing rest, and these cross over into other systems of the body. One response appears to be normalization in the immune system. One example is the skin rash case in my list of case studies. That client had a horrible full-body rash after a divorce that left him deeply exhausted. He went to 3 dermatologists, but none of them could identify his condition. They all recommended an immunosuppressant for his overactive immune system. His rash was almost gone after 2 ANSSR treatments, 1 week apart. No chronic pain, just exhaustion and stress. On the other hand, his rash may have been caused by leaky gut syndrome. If that was the problem, then facilitated rest may have helped with repair of his GI tract. Rapid tissue repair may be another secondary response. There are times when a client feels a strong positive sensation in a spot of pathology, but it's not a discharge and it's not bones moving. Client's feeling is that it's some type of healing activity. For example, one of the clients I interviewed had a broken back, a compression fracture of her first lumbar vertebra. In her second visit, when she was energized, she felt strong sensations around that bone that felt like healing activity. We'll never know for sure what it was. What we do know is that she walked away from that visit with no pain after 35 years of nonstop pain. That's a result of actual healing. And she did not have a pain discharge, which is interesting for me because I expected a pain discharge. Healing of any kind requires energy, which comes partly from comfort and rest. But we don't know how much more your body can heal when you reach absolute comfort, because absolute comfort is a new phenomenon in medicine. So there's endless research waiting to happen for people who want to raise their healing capacity as high as possible.